Hi everyone, welcome back to Step 2 Crackdown. Today we're going to be talking about tremors and we'll break down the 4 key types of tremors that you need to know. These are the essential, resting tremors, cerebellar, and physiological tremors. So let's start with the most common movement disorder, which is the essential tremor. And I have a really nice mnemonic for this, which is called beta. The B stands for bilateral, the E for essential, the T for tremor with activity. So it's an action tremor that gets noticed, or it happens when a patient is moving doing some voluntary movements. And the A stands for alcohol responsiveness. So a lot of patients will use alcohol to self-medicate themselves because it makes the tremor unnoticeable, and it's also a tremor that runs in families, so it's hereditary. Then we have resting tremors. So when you think of rest, think of Parkinson's. In Parkinson's, we have the pill rolling tremor, which is a resting tremor. And this tremor essentially happens at rest, but it disappears with activity. So it disappears with movement. And the question stem will mention that the patient has other symptoms of Parkinson's, like bradykinesia, rigidity, and postural instability. Next up, we have cerebellar tremors, and these are also known as intention tremors. So this type of a tremor is associated with cerebellum, right? So we know cerebellum is involved in coordination, and anything that's affecting the cerebellum, like a mass or tumor or an infection or an infarction, can cause cerebellar tremors to happen. And this is associated with ataxia, dysmetria, or a gait disorder. The tremor, it increases with goal-directed movements. So in the cerebellar exam, when we're doing the finger to nose test, essentially what happens is that the tremor, it increases steadily as the hand reaches its target. So that's how you can tell in the question stem if this is cerebellar tremor or not. Then physiological tremors are tremors that are low amplitude, and they are usually too small to notice under normal conditions. Too small to notice under normal conditions. And they get enhanced by increased sympathetic activity. So if the patient is drinking, like having lots of caffeine during the day, suffering from anxiety or hyperthyroidism in which your sympathetic system is overactive, all of this can enhance physiological tremors. And lastly, physiological tremors, they usually get worse with movement, and they can involve the face and the extremities. So that was it for tremors. So now, just to summarize, essential tremors are bilateral. They're action tremors that improve with alcohol, and they usually run in families. In Parkinson's, you have the pill rolling tremor, which is a form of resting tremor. Cerebellar tremors are those tremors that are associated with ataxia, dysmetria, gait disorders, and they increase with goal-directed movements. And physiological tremors are too small to notice under normal conditions, and they're usually stress-induced. So that was it. If you found this video helpful, please give it a thumbs up and subscribe to this channel for more videos.